Hello, my name is Andrew Scroy. My presentation about schizophrenia, and this is for Psychology 630 Psychopharmacology at Ashford University. My instructor is Dr. Nicola Lucas, and today is December 15, 2016. Schizophrenia is a serious and major mental disorder. Schizophrenia, if treated, can be managed quite well. If the disease is not treated, it will be regressive in nature. People with schizophrenia often suffer terrible symptoms such as hearing internal voices not heard by others, or believing that other people are reading their minds, controlling their thoughts, or plotting to harm them. These symptoms may leave them fearful and withdrawn. Agrawal, 2016, page 5260. Patients become out of touch with reality, hallucinate, and become less social. One of the most common reasons why schizophrenia manifests is because there is a chemical imbalance inside the brain with the neurotransmitters. Inside the brain, there are many nerve cells and neurons. These neurons communicate with all the nerve cells. The signal is produced are neurotransmitters. There are more than one type of neurotransmitters. The most crucial neurotransmitters are those involved with schizophrenia are dopamine and serotonin. While dopamine and serotonin are both very important neurotransmitters, they control different functions. Dopamine is associated with the pleasure area of the brain. This will include love, happiness, even hate. Serotonin, on the other hand, is associated with the regulation of mood. When there is either too much or too little dopamine active in the system, it causes a chemical imbalance. In the case of schizophrenia, there is too much. When there is too much dopamine, it causes an overstimulation in the sensory input and does contribute to the majority of schizophrenia symptoms. Serotonin has a similar effect on the body. When serotonin is not regulated correctly, it alters the person's mood. To reiterate about dopamine, the dopamine hypothesis states that the symptoms such as hallucinations, delusions, and psychosis associated with schizophrenia is a direct result of having too much dopamine in the system. This conclusion was derived from two known facts. One, abuse of stimulant drugs that are known to increase sympathetic dopamine concentration, such as amphetamine, produce a syndrome indistinguishable from the paranoid type of schizophrenia. And two, antipsychotic drugs are dopamine receptor antagonists that block dopamine receptors in the brain. Advocate, 2014, page 338. There are two treatment options available for schizophrenia: drug treatment and therapy. Drug treatment involves the use of antipsychotics, which control and limit the reoccurrence of psychotic episodes. Antipsychotics were first introduced in the 1950s and were referred to as typical antipsychotics or first-generation antipsychotics. While very useful, they produce severe side effects. In the 1990s, atypical antipsychotics were approved for use. These had milder side effects, but could also be as intense. These were considered second-generation antipsychotics. Both typical and atypical antipsychotics continue to be prescribed depending on the severity and the effects of the treatment plan created. Some of the more common typical antipsychotics are Haldol, L'Occitane, and Thorazine. The common atypical antipsychotics are Clorazil, Risperdal, and Abilify. There continues to be new treatment options and medication for schizophrenia. One such treatment is brexpiprazole. Many atypical antipsychotics improve functioning, but they carry risks for adverse effects. Brexpiprazole reduced symptoms of acute schizophrenia and prevented relapse with minimal adverse effects. Scarf, 2016, page 28. Because drug treatment does not typically help with social skills and work skills, therapy is a supplement treatment that will help the patient live a healthier life. The benefits of taking medication for schizophrenia far outweigh the risks. Medication helps with the elimination of psychotic episodes and the adverse symptoms, such as hallucinations and delusions. The risks that come with the side effects, depending on medication and the dosage, they will vary from person to person. Typical antipsychotics do have more severe side effects, such as tremors, paranoia, anxiety, and dystonia. Not taking your medication is extremely serious and is not feasible for the treatment of schizophrenia. Thank you for your time.